Welcome, everybody, to our Monday night wellness webinar. And tonight we're tackling the topic of digestive disorders, and in particular Chrons and inflammatory bowel conditions. And so we're going to, you're clicking though, Joe, right? So we want to tell you a little bit about the kinds of digestive disorders that people really suffer from: acid reflux, acid indigestion, irritable bowel diseases and inflammatory bowel diseases, bloating and gas and constipation and diarrhea, burping and belching. And, you know, they're all very common, and they're things that you hear a lot of commercials about, but the reality is they're very uncomfortable. Acid reflux and acid indigestion and heartburn and ulcers and nausea. These are very unpleasant, uncomfortable conditions, and most of what the medical profession offers are treating the symptoms of them, and not the cause. So let's look at what the cause is. Joe, you want to click? And I want to make a comment in particular about, you know, when you think about the conditions of digestion, your digestive system is actually in two parts. The upper part is the stomach part, you know, the part that's right behind your rib cage, and that's where people get, you know, the bloating and gas and acid indigestion. And many times the medications that are given for that are medications that reduce acid production. They're acid blockers. The Prilosec, Prevacid, Nexium, those kinds of products. But I wanted to just make a note for everyone to understand that acid in the stomach is actually very important. That's why nature put it there. And so we don't want to get rid of it necessarily. It's very important. There's a lot of bad bacteria that can enter the body through the mouth, through our food, and that acid acts like a sterilization tank. You know, immediately falls into that acid, and the acid controls the proper pH. You know, pH is a measurement of acidity and alkalinity for friendly bacteria to thrive and bad bacteria to die. So you don't want to mess with that too much. It begins the process of breaking down our food, especially protein, and a lot of the discomfort that people experience is when food drops down lower into the stomach. It doesn't get broken down, and so it lies there and ferments rather than digests, and it's very uncomfortable. And if food isn't properly broken down, it can produce toxins. So what really is behind acid reflux, you know, before you start taking medications, understand that the causes are what we always want to look for. Now, stress is a big one, for sure. It will increase stomach acid production. But it is just as likely that stress will suppress it as well. You know, that when you think about the fight or flight response, you know, when you're walking down the path and a tiger's jumping in your way, you know, your body now is in a survival mode when it evokes that stress response. And so it diverts all the energy away from the stomach, away from the digestive juices, toward the muscles and the brain, so that you can either fight or, in most cases, I think it's probably a better option, to flee. And so that kind of thing really, imagine the amount of stress people are on today. But the big one are diets that are high in sugar and refined carbohydrates and wheat. We're going to be talking about that tonight a bit also. So if you have a question about whether you have too much or too little acid, this is kind of a simple test that Nidra Sar, who's a nutritional consultant, master's degree in nutrition, that she told us, and she said you put 2 tablespoons of apple cider vinegar in a half a glass of water and take it on an empty stomach and then wait 15 minutes and just see how you feel. And she said if you don't feel any burning sensation, then chances are you've got too little stomach acid, not too much. Okay, click, Joe. And just as a reminder, these medications, like all medications, come with side effects. And so you want to be aware. You know, you want to be aware that try the natural things first, if you can. There was a young man that my son works with, 23 years old, called me about a month ago with severe gastritis, and he was in a lot of pain, and so I walked him through his diet, and we're going to show you some of the changes in the diet that I recommended and the supplements that I recommended, but he was on one of these acid-blocking drugs, and within 2 weeks, just by making a few shifts in the diet and adding a few vitamins, he was off those medications, and he's been off since. And he went from having almost chronic continual pain all day long to he's still healing, but he was down to like once or twice a week last when I talked with him about a month out. So it's really wonderful what the body can do when we stop abusing it. Okay, click. So those are the kinds of things that kind of affect the upper digestive tract, but we're going to concentrate a lot tonight on the lower digestive tract because these the numbers for these are really high. The irritable bowel syndrome, inflammatory bowel conditions, constipation, diarrhea. Many of these are inflammatory conditions, and I made a little note here about Omega Guard. The omega-3 fatty acid product is a natural anti-inflammatory. It can be very helpful for that. But we're going to go in more detail to understand a little bit behind what kinds of things we can do to help healing of this area of our body. So we're going to be focusing on lower digestive tract. I'm going to click, Jill. And we've invited Hannah Sharapan to join us tonight, and she's going to talk to us about her experience with Crohn's disease. So, Hannah, thanks for coming.
Sure. Hi, everyone. I'm so glad to get to talk to you tonight, primarily because if there's anybody that you know that hears this program tonight, and it can make a difference in their lives, how wonderful that'll be. And do suggest that if somebody's invited you to this call, if you feel as strongly about it as we do, make sure that you call them afterward and let them know that you feel that this is something you want to know more about, and they'll be glad to help you. And I'm so glad that somebody reached out to help me many years ago. And my problems actually began in 9th grade. I was just out all the time and with not real defined symptoms. I had acid reflux, I had stomach pain, but nobody really knew what it was about. I had some tests, nothing had shown anything. And by my senior year, I missed most of my senior year. In fact, they had to lie on my report card because in Pennsylvania, you could not miss more than 29 days. You had to be retained. Huh. And since I was near the top of my class, I guess they felt that I deserved to graduate. So they did pass me anyhow. But I missed my senior prom, which was so painful. Mm-hmm. And I can still remember at graduation, I'm ready to walk down and parade, and Millie Caldwell, the school nurse, hands me smelling salts. And that's when I realized how bad I must really look. It was so depressing. It just kind of took away from the whole graduation ceremony. And I went off to college, not very healthy, but I did, and by the end of beginning, actually, my second term of school, I was in such bad shape that I was actually falling asleep sitting up in the library and in all this discomfort. So they finally told me I had to go to have some serious tests done, and one of the things they did were all kinds of scoping. They did upper and lower GI, and it finally revealed that I had Crohn's disease. Nobody even knew about it at that time. It was so rare. And at that time, they also said that it is something that is chronic and you're never going to get past it, and maybe we can keep you at least somewhat healthy. And my blood levels by that point were so low that they had to give me iron injections for a full month. And I don't know if anybody's had an iron shot. It does not feel like any other shot I've ever experienced. It's much more painful than if I had tetanus shot. And the pain remains long after. But anyhow, they got me to the point after pulling out of college for one term, and of course I was devastated because I just met who became my husband, Alan, and I kept thinking, oh, if I'm being there, he's going to forget about me. My friends are going to forget about me. It was an awful experience.
Sure.
But they put me on some medicines. Well, with those medicines, I vomited every single day for the next 6 years.
Oh.
And not one time did they ever think that it could be a side effect from the drugs, which it actually was. Eventually found that after the fact. And I had repeated hospital stays. They usually were about 3 weeks, followed by a long recuperation at home, so I was pulled in and out of school, and it was very difficult. And I was doing better before our wedding, but the morning after our wedding, I woke up in excruciating pain. Probably should have gone right to the hospital, but I didn't. I just assumed it was a disease and that I could handle it. But it had a really unhappy effect on our honeymoon, although we've had many honeymoons since. But here, what was happening was I was actually perforating. And I really could have died if they not found it eventually. By 3 weeks' time, I was back in the hospital again. But then the last year before I finally had surgery, I was down to the only things I could tolerate were tea, jelly, and soda crackers. Absolutely zero nutrition. They didn't even know about TPN, which is the tube feeding at that time. And during that time period, my hair grayed prematurely. My skin actually lightened. Fortunately, it lightened evenly. My teeth yellowed. I was down to 69 pounds by the time I had surgery, and I'm 5'2". And even though that's not tall, 69 pounds is pretty darn thin. Now, in my case, I was very blessed to have found a fabulous surgeon who really studied my case and really determined ways that he could save as much of the intestine as possible. And he was actually able to just remove 3 relatively small sections and rejoin me. And it made such a difference. I felt like I got my life back. We adopted our first 2 children, Hallie and Danielle, because they actually told me that I shouldn't have children. And became pregnant with Ashley. And so Danielle and Ashley are 10.5 months apart. But anyhow, I did have some serious problems during my pregnancy. One of the things that happened was that because I had to strain so to be able to move my bowels, because unlike a lot of people with Crohn's who have chronic diarrhea, I have the reverse. So the straining actually caused to a point my cervix actually dropped out of my body. It was actually visible. So I had to go to bed, even though I had these 2 other little children.
Oh, my gosh.
And have my feet up until I was further along in my pregnancy where it would pull the cervix back up. Later in the pregnancy, I developed a rectal abscess. That's really, really painful. And that continued on, and from there I just kept having bowel impactions daily. So they decided they had to start to rectally dilate me. I had to go 45 minutes each way every day to have this rectal dilation. So I guess I should be glad I had her a month early, because it was 6 weeks of that I went through those. But even after I delivered Ashley, which fortunately she was a beautifully healthy child, they still felt that they had to continue to do those dilations because I continued to have bowel impactions. And so I was having those every week for, well, the next 7 years, I guess it was. And then finally, fortunately, we were introduced to Shaklee through a very unusual way that I feel really blessed that it came to us. In the first month, I stopped needing dilation. The first month, I was able to absorb my food for the first time in my life, and I was actually able to gain weight. It was also the first month that I stopped having menstrual cramps and PMS. My mother used to say I had 2 good weeks a month, because it was one piece of PMS or going through the menstrual issues. And gradually over a period of time, and this is something I think that's important to also point out, when you do have health issues, don't look for everything to suddenly go away. Sometimes maybe it's energy comes first before anything else, or maybe first allergies will be under control, but you'll still have something else. It's almost like you can draw a timeline, and the longer you're on the product, the greater the result. So a few months later, the migraine headaches that I had been suffering with from the time I was 5 years old, where I'd have to be in a darkened room, nobody could touch the bed, and it would just go on forever, it seemed. And those were gone. Now, 4 years later, I went back to see the doctor for something else, and he said, well, as long as you're here, let's just check the scar tissue. He wants to check me rectally, and I said no, and he said yes, and he won. And after he said, Anna, all my years of medical practice and training have taught me that scar tissue is permanent, and your scar tissue is gone. He even wrote me out a letter to show people if they challenged me.
Wow.
So continue to really have a healthy life from then on, healthier than I've ever been, feeling healthier than I did when I was 18 years old and still do at this age. And just to give you a little bit of an update, Joe, turn, please. Okay, no, wait, back one. Can you go back one, Joe? That's it, thank you.
Mm-hmm.
So I've been fortunate. I've not had to be on medications all of these years. And, a very important point, Barb brought up a few times now about side effects of medications. A very dear friend of mine who has very serious Chrons and has had multiple surgeries. She's been on some of the most serious medications that they give for Chrons, and many of them are really a form of chemotherapy. And she has so many issues today that have developed that the doctors even tell her are all as a result of the medications that she was on. So let's keep in mind that, as Barb said, it's not to say there's never a place for drugs. I think, Joe, you mentioned that in the pre-call, too. It isn't to say that. That sometimes we can replace drugs. Other times we can at least maybe take less drugs, and many times get healthier and healthier to the point that either the drugs can be diminished that much more or even completely off them. So I think it's a real important thing to be tuned into that and see if there is a way that you can get the relief you're looking for. And just recently I did start to have some issues for the first time in all those years that it didn't feel the same as having the Crohn's pain, but I just had some issues. I had a feeling that there was some internal scar tissue. And through testing, it was discovered, yes, indeed, I did, and to the point where they felt that they needed to remove it. So I had surgery in October to remove a very small section where I had been previously joined. Where they join the intestines, they call it an anastomosis. The doctors were amazed because they said no anastomosis lasts 46 years. Typically, it's 2 to 10 years. So I have to credit Shackley, of course, with a good portion of that. They were amazed at my fitness, which I feel really great about. They were amazed at my recovery. They just would come in and they'd send teams and nobody could get over that I was doing so well so fast. And in less than 3 weeks, I was literally doing everything again, even push-ups. So, it just is a great blessing. I feel great. I feel extremely blessed. And I really thank you, Shackley. Thank Dr. Shackley. I know that I was led to this and feel really good about that, and also feel very passionate about helping other people who also have this issue or perhaps one of the other digestive issues we're going to be talking about tonight. But we are going to be talking in just a minute, too. I do want to tell you a little bit more about gluten.
Go ahead.
This comes first. Now, would you want to go ahead and do this, and I'll do that on the gluten page?
Okay, sure. Go ahead, Jeff.
So I think one of the things we need to be aware of in terms of getting healthier or dealing with illnesses or health challenges is we have to realize what is it that's causing us to be and feel the way we are. And Brenda Watson, in her book Road to Perfect Health, identifies 6 factors that cause unhealthy gut. And one is antibiotics and medications, which could be in our tap water, our meats, poultry, our foods. We need to look at that. The lack of probiotics, which are the good bacteria, the good flora in our colon that keeps things healthy there. Acid-suppressing medications. Now, another thing to keep an eye on. Undigested and partially digested food, environmental toxins, and then age. Being 50 or older means that you have the bifidobprobiotics declining dramatically. And just those are factors for us to be aware of and to look at when we're trying to correct a digestive problem.
So, Hannah, do you want to talk about the gluten? Go ahead.
Yes, I did want to mention some things about that because about 7 years ago, another friend of mine discovered that she had celiac. And she started to tell me that she felt I should be tested. And I said, well, I'm doing so well. Why do that? And she started to tell me that, first of all, you don't want Crohn's to come back. And secondly, there are a lot of other issues that can come if you do have a problem with gluten. It is not all digestive issues. Thyroid, arthritis, many other ailments, vitiligo, can have a connection to the gluten sensitivity, as even so many forms of cancer are shown to have a relationship. So she convinced me to have the test. Many doctors take a blood test and then they'll say you don't have a problem with gluten. It is not a valid test. The only way, from everything I have learned in the last 7 years, that you can possibly know if you really have a gluten sensitivity is either to do a biopsy, or a lot easier than that, is you go to a lab that does DNA testing and also fecal testing, and then that will determine whether you have the genes or not. If you have them, you always have them. If you don't have that gene, you'll never get it. But it's worth the testing, and I do want to mention the lab because Dr. Margaret Christensen is a doctor in integrative and functional medicine, and she's outstanding. And she told me when I first went to her, and I told her I had a gluten sensitivity, she said, what lab did you have it done? And I said, Entero lab. And she said, good, because if you told me any other lab, I would have had you retest. And that lab is ENTEROLAB.com. And they send you the package. You have the test right in your own home, and FedEx picks it up, and you get the results in 2 to 3 weeks. So if you really are suspicious, it can really help you to confirm it that way. But, the more that they are saying, because of the genetic modification of the wheat and oats, wheat and corn and things like that, soy, that it is becoming a much greater issue for a lot of people who might have had slight effects from digestive issues to creating much more serious digestive issues. And fortunately, of course, all Shaklee products are non-genetically modified. We're so proud to be able to say that from our soy on. And so, as we say here, the sensitivity develops as the antibodies have to really react to try and break down the gluten. And that creates inflammation. In the case of celiac, it damages the villi and allows bacteria and partially digested products to get into your bloodstream, which then causes inflammation. And, of course, we now know that inflammation can be a cause of cancer and it can be a cause of heart disease. And the statistics on celiac, 1 out of 100 have it now. I'm reading and hearing that that's true of gluten as well, gluten sensitivity. And I do believe the Crohn's must be on the increase because now it's almost every day somebody comes to us with it. So, Barb, tell us more about the wheat belly.
Well, I think the concern about wheat and gluten and refined carbs is really becoming more prevalent now as more and more authors are picking up on it and really bringing this to the public. One of the first ones was William Davis, who wrote Wheat Belly. He was a cardiologist. And he said, and I use the quote from the book, he said, since the introduction of dietary guidelines in the 1970s calling for reduced fat, a strange phenomenon has occurred. Americans have steadily, inexorably become heavier, less healthy, and more prone to diabetes than ever before. And he goes on to, of course, make that link to the tremendous amounts of wheat that Americans eat. Today's wheat is genetically altered to provide greatest yield at lowest cost. It is not about health. And it causes blood sugar to spike more rapidly than pure table sugar. And this is the part that you want to be sure everybody gets. It is more addictive than cocaine. It is, and it causes us to ride this kind of a roller coaster of hunger. Then we overeat, and then we get very tired and fatigued from it. The wheat is associated with all kinds of other illnesses besides just the digestive ones. And following up with just this last September, another book came out called Grain Brain, and it was written now this time by a neurologist, and he was making the connection between these modern grains that are silently destroying the brain, and he connects it to all of these neurological conditions. So I just I wanted you to see those two books in case you wanted to read about them further, but all of them are really suggesting to us we've got to make some changes in our diet and move away from wheat in particular and more toward the healthy stuff. Joe?
Yeah, and I think, Barb, that's a critically important. If we or someone we know has digestive issues, bottom line is you got to look at what you're putting in your body, and the junk food, the food heavy in sugar, refined carbohydrates, wheat, all that stuff. You got to get that out, and then we get in the healthy food, the fruits, the veggies, all those things that are really going to benefit us.
A few years ago, Michael Pollan, some of you may be familiar with him, he and many others have been trying to sound the alarm and alert people about the importance of us changing our diets. And basically what he says is, he has what he calls food rules. Rule number 1 is eat food, meaning real food that grows out of the earth, not too much and mostly from plants. Mm-hmm. And so if you click, I just wanted to point out that there was a remarkable study done a few years ago with the Shaklee Vivix product. And they had these college students, divided them into two groups, and they had them eat this very, very high-fat 900-calorie breakfast with all kinds of little fried things in it and sausages and sausage, I don't know what it all was. But anyway, it was, the reason I wanted to mention it here is then they monitored what happened within the cells of those young people over the next several hours. And the high-fat diet caused tremendous damage inside the cells, tremendous damage, inflammation and damage to the DNA. And what was interesting about the study was then group 2, they administered Vivix to them, this wonderful anti-aging polyphenol tonic that Shaklee makes, and immediately Vivix activated longevity genes within the cells that started to reduce the inflammation and repair the DNA and repair the little mitochondria that produce the energy in the cell and so forth. But the point we want to make is it is tremendously important what we eat affects our cells. And so we need to move back to these natural diets. Okay? Joe? So diet, moving toward the natural things, natural fruits and vegetables, away from the refined carbs and the wheat, and then we want to add a few supplements. So we're going to tick through these now and give you an idea of how they work and how they benefit the digestive system. Okay, Hannah?
Well, first of all, the Up the Floor is one of the key products. In fact, I've actually seen people have results with their IBS as soon as they just start on Optiflora. Mm-hmm. It can help them very, very quickly. And, of course, we are exposed to bad bacteria, and certainly from the yeast we eat, all of those things start to do the increase in the bad bacteria and wipe out the healthy bacteria. Antibiotics wipe out the good bacteria. So what happens then, of course, it has all kinds of effects from everything from the gas and bloating and diarrhea and so on. It can even be part of the acid reflux. It can be part of allergies. It all makes a big difference in weakening the immune system. And remember, better than 70% of your immune system is in your gut. And, of course, one of the reasons why our product works where other probiotics do not ever have this kind of difference. Most probiotics, the bacteria has died before it ever gets to your colon. Whereas Shaklee has this system that is incredible. So it completely survives the stomach acid. It releases them in the intestine, so we can guarantee you 500 million healthy live bacteria in every single capsule. So that's why I think it makes such a difference. And we even have lots of moms warm it up and squeeze it and put some on their finger and let the babies suck their finger, because you normally want to certainly swallow it whole so that it gets to the intestines. But the babies aren't going to need as many of the bacteria, so they'll at least get some that way, and they're seeming to get some really nice results.
Mm-hmm, very good. Well, and I also want to point out that probiotics are really important in the intestines for other than just helping to heal the gut, and so I want to just tick through them. 70 to 80% of the immune system is located in the gut, and you need those probiotics to maintain the lining of the gut, so you're preventing parasites and toxins from entering the bloodstream. Most people have a very damaged wall in the intestinal tract. It enhances the detoxification of heavy metals and chemicals, and it produces some very important vitamins. So probiotics are really critical. They are not optional, and that's why Shaklee, if you want to click, includes them in their Vitalizer, because it's considered so important. It's that tiny little pearl there. Anything else you want to say about Vitalizer, Hannah?
Yes. Yes, I think that one of the things about this program, not only is it simple, easy, and convenient, but more importantly, it works. And a lot of what we're going to tell you about tonight, various nutrients that help with digestion, many of them are in this simple, easy program. So it's a great idea, and either as an addition to what you take with other Shaklee supplements, or whether you have just a strip a day, certainly makes a difference. And you're going to see a lot of things we're talking about. We're going to talk more about the omega-3 fatty acids, and how each of these make a difference in your immune system and also your digestion. And feeling good and getting lots of energy. And there is no other product out there like this where we actually have patents on our delivery system, because Shaklee has found a way to make every one of those 80 nutrients in those 6 tablets and capsules break down at exactly the right spot in your intestines and in your stomach, whichever is supposed to be in the stomach, like your multi and so on. And then the probiotic, of course, not breaking it down till it gets to the colon. So therefore, you're getting all of those great nutrients absorbed, which makes the difference. It isn't just what's on the label. It's what we can absorb. Right?
Very important. Yeah, good. Yeah. So EasyGest digestive enzyme is a favorite product of mine, and it helps for millions of Americans too who suffer from gas, bloating, indigestion. If you have trouble digesting dairy products, ideally, you take it probably before a meal. But I have to say, I have sometimes taken it after I've eaten, when I'm beginning to feel some indigestion.
Absolutely. Yep.
And it works.
Results are almost in minutes.
Yeah, I was going to say instant. It's just wonderful. And so this is it's a great product. And part of it is it eliminates or it enables or breaks down, foods into easily absorbed components, and it improves the digestion of milk sugars, the end result being that it enables nutrients to be absorbed into the bloodstream. And whether they're from supplements or food, we want the nutrients into the bloodstream so it can go out and feed our cells, or there's no, we're not going to get the value that we want. And they're all plant derived. There's no concern about taking them. Gas, bloating, belching, burping, indigestion, stomach cramps, overeating. I occasionally, when I've overeaten, I find that it just gives great relief.
And then, of course, fiber. How important is fiber in our diet? We actually now know that we need to consume a great deal more fiber than Americans are consuming. We actually should be consuming about 30 grams of fiber a day, and most of us consume much less than that, as you see illustrated there. And there are a lot of ways of getting the fiber that we're going to talk about, in addition to eating more fruits and vegetables, certainly heavy on the vegetables even more than the fruit, because this is a way for you to be able to lower your cholesterol naturally. And fiber actually helps metabolize the sugars in the body, so it helps normalize those blood sugar levels. And you've probably heard how fiber can help promote regularity and good colon health. And one of the ways is because it eliminates toxins. When you eat, you really want those toxins to be leaving your body within 12 to 24 hours after eating. So a lot of people who do not feel they are constipated because they're not in pain still can be constipated. We really need to move our bowels thoroughly every single day.
That's right.
So some of the fiber products that we suggest would be Shaklee's Fiber Advantage bars, yummy, or our fiber tabs. And usually I suggest to people to start on the fiber tab because there are only 3 grams of fiber in that daily amount, which is gentle way of getting the body used to more fiber. And then, as you're used to more fiber and you use smoothies, you'll get more fiber in their smoothies. And then finally in the Fiber Advantage bars, there are 8 grams of fiber in just one of those little bars. So great way of increasing your fiber in a healthy way. No saturated trans fats, they're low glycemic, everything we have is gluten-free. So they really are some ideal solutions, don't you think?
Yeah, absolutely. And I've had experience with a lot of these products because I have I've had digestive issues, and I did that testing with Dr. Margaret Christensen that Hannah was referring to, and found out that I have a gluten sensitivity. I'm on the low end or the beginning end of the spectrum, and I found that once I removed gluten from my diet, it made all the difference in the world for me with a lot of things. But occasionally, I still find a need for something like stomach soothing complex. If you have occasional indigestion, upset stomach, a queasy stomach, like even for people that travel, motion sickness, seasickness. I know Shackley, the last several years, every time one of our trips has been on a cruise, they've given each of us a bottle of stomach soothing complex. And
it helps.
a couple of years ago, everybody was getting sick. People were turning blue and falling down like crazy. And Mike and I felt so good because we weren't getting bothered at all. But that's another story. But even for chemotherapy or after surgery, this stomach soothing complex I think is wonderful, very soothing to the stomach, a refreshing taste. A person, you could chew it if you wanted to. I usually swallow mine, but some people I know make it into a tea. And I think the fact that it stimulates the gallbladder and liver to create, the products that they're supposed to be doing to help in indigestion. Right. And Herblax is one of our original formulated products by our founder, Dr. Shackley. So this product goes back decades. And it encourages a mild cleansing action that aids the body's natural processes. And as you can see, all the things it does to help improve regularity, reducing body odor, even bad breath, improves acne, relieves constipation, helps with headaches, dark circles under the eyes. Now, isn't that interesting? So this is just, it's this also because it is a gentle herbal laxative because one of the herbs in there has a laxative-like effect on the body, but this is not, I've been taking it for decades, and it's not, on and off. It's not habit-forming where you feel like you've got to have it every day. Right. And then, lastly, alfalfa. This product to me has always been amazing. The roots of an alfalfa plant go down 10 to 20 feet, which means that they can seek out minerals in the lower layers of soil, which are minerals that are inaccessible to other plants. And it's been used since the time of Egyptians to help with digestion and soothing queasy stomachs. But as you can see, Shackley's alfalfa is very held to a very high standard in that it is very pure, helps with all kinds of issues, ulcers, stomach ailments, colon problems, gas, water retention, body odor, again, bad breath, arthritis, allergies, sinus congestion. I know one of our very early experiences with a customer was with alfalfa for arthritis, and you can take large amounts of this.
That's right. And that's one you can use for little babies, young children. It's literally a food. It was a food, human food in biblical times. But alfalfa is very soothing to the stomach. So for kids, absolutely.
Well, for congestion too, for kids.
And congestion, yes, exactly. So I saw a couple of you were asking questions about that. Yeah, alfalfa is a great starting place, and Optiflora, same thing.
Yeah, right.
In fact, the word alfalfa literally means the father of all food.
That's right. Yes. Yeah.
Very good.
Well, let's talk a little bit about a starting program for Crohn's, colitis, some of the more serious digestive And this is not a prescription. We don't prescribe in our business, but we do share based on the results that we've experienced. And then, of course, there are a lot of medical people in Shaklee who are able to make stronger suggestions than we're allowed to say. But one of them that I think everybody agrees on is the Optiflora. I really believe that whether you have digestive issues or not, everybody should be taking Optiflora, because I can still remember our company is very conservative in their claims. They don't say anything that they can't back up. And I still remember when it was introduced, because I wrote in my notes because I was so excited personally, was that if you take Optiflora every day, it can help reduce and help prevent colon cancer. To me, that's huge.
Mm-hmm.
But in addition to that, all the things that we talked about tonight, and by the way, babies who have Optiflora don't get ear infections, we found. And we have 6 grandchildren to testify to that.
I got a dog. Well, some dogs have the flopping down ears.
Yeah,
right. I mean, some dogs' ears stand up, but some dogs' ears flop down, like a Cocker Spaniel kind of thing.
Yeah.
Anyway, they are more prone to ear infections, and Optiflora is very effective. That was just a little aside. Okay, back to alfalfa.
Yeah, well, sure, our pets are important. Okay, so Optiflora certainly I feel personally is a must. And alfalfa, for all the reasons that Joe just described so well, really can make a big difference. It actually has 8 digestive enzymes that naturally occur in alfalfa. And the omega-3 fatty acids, some people have heard fish oil. Well, Shaklee's Omega Guard is the greatest, safest way for you to ever get your omega-3 fatty acids. And I know nutritionists who say we are the only company that knows to make them with all 7 of the omegas and in the right balance. And EasyGest, you heard about that today, and B-Complex. B-Complex actually is a digestive aid of sorts, and it certainly helps with stress. And most people who have digestive problems are either under stress or stress helps cause the digestive problems. It's sort of a both way kind of thing that happens. And B-Complex can make a huge difference for that as well. So I usually suggest to people who are really in the process of inflammation or having some difficulties currently to start with that program, and then to really consider adding vitamin E, because in particular, Crohn's actually keeps building up scar tissue that closes off the intestines. So a great way of helping break that down is vitamin E. And the calcium, magnesium, either of our calciums are wonderful. Osteomatrix is a great calcium supplement. But for people who get a lot of stomach cramping and are sensitive to magnesium, chewable calcium magnesium is just that much gentler. And it's fabulous natural antacid. So if you have the acid problems, of course, as well. And then getting into one of our protein products, either the instant or the energizing soy protein or the smoothies. Vital E, unless you're using the whole strip, of course, then you get the Vital E in that wonderful Vitalizer strip. And then get that extra fiber in your diet, beginning with the fiber tabs. And this program has seemed to make a huge difference, because wherever we have been guest speaking throughout the country, we get comments from people come up and tell us that they did this program and how the kind of results that they have gotten from taking Shaklee supplements with their health issues.
And many of these products are very inexpensive, but they are remarkable. So there are the specific ones that people like to start with when they have the general digestive disorders, and then we have Hannah's program for people who have Crohn's, which especially sometimes when people are starting on these products, they really are in a position in their digestive system where there's a lot of inflammation, and the intestines are very sore, and so sometimes you've got to go slowly when you start. But it is, you can take one day, take Optiflora for a couple of days, then add the EasyGest. I had a customer who I always have to keep a lot of EasyGest in my home, because I had a customer who just all of a sudden started to develop these very painful digestive issues, probably had a form of gastritis, and EasyGest just was such a godsend to her. And so she now buys 2 and 3 bottles at a time, although as time has gone on now over the last 2 months, as she's taken the other supplements and she's starting to, heal the gut, she doesn't need them as much, but she doesn't ever want to be without them. So she always has one in her handbag and she always has one in the kitchen, and because it's so uncomfortable. But these are just wonderful products. So there's the collection for you there. Joe, are there any questions that we need to field?
Yes. Number one, Hannah, people are asking you to repeat the name of that lab for the gluten testing.
Certainly. It is Entero Lab, ENTEROLAB.com. And, it's a pricey test. It's about $360. Many insurance companies will cover it. Some will not. But again, you only have to have it once because you either have it or you don't. One other quick comment that we did neglect to have on my program there is Vivix. Since Vivix has come out, remember that product works at the cellular level. And if it's actually healing at the cellular level, it just makes sense the value that it can be for digestive issues as well.
I also see that there's a question here about people who may have sensitivity to soy being concerned about soy lecithin, which is used to coat a number of the tablets. And usually people who are allergic to soy are allergic to the protein part of soy, not the lecithin. Shouldn't bother them at all. And for a nursing mom, Vitalizer is one of the healthiest supplements that you can take. They would take the Vitalizer with iron, but that is a really nice complete form for them, so it's very good.
In fact, there are many physicians in Shaklee that actually have their patients automatically get on that, either for infertility or for pre-pregnancy or actually for pregnancy as well.
Barb, for that acid reflux or acid test, somebody wants to know if they can use regular vinegar instead of apple cider vinegar. I think they should need the apple cider, don't they?
Yeah, that's the way I've always heard the recipe, but I'm trying to think why they would. I don't know the reason why. I'm guessing because some vinegars might have more sugars in them, or
they might be more acidic,
or they might have more bite to them.
Yeah,
I don't know, but I would do it with and apple cider vinegar is the kind you want to have. The health food stores now really have some very nice versions of that.
Yeah. Can a 1-year-old take Easy Just?
Well, probably, but I would first always go do the food stuff first, and so for a 1-year-old who's having I don't know what kind of problems they would have, I would do the Optiflora first, and alfalfa, and then, the Incredibites and the Mighty Smarts and the Chewable C, those kinds of things first, and really then work on the diet. 1-year-olds need to be eating vegetables also, and cutting out carbs and refined stuff and wheat. That's what I would work on. I would, all the things we've talked about tonight, try to clean up the diet as much as you can. With a 1-year-old, you have a little more control. And then I would do those other supplements first. Because see, Easy Just, your pancreas is supposed to produce digestive enzymes. And if we wear out our pancreas, if we exhaust it, by, exposure to, just too much carbohydrates and so forth, then it's not producing the digestive enzymes that it needs to. But when Hannah was talking about B-complex, see, that's one of the nutrients that the digestive system uses to produce digestive enzymes and digestive juices.
Good. Can the prebiotic cause elevated blood sugar or excessive urinating or dry mouth?
Well, it is a sugar. It's a fructooligosaccharide. It's a sugar. But the way to find out is just eliminate it and see. I've never heard of that. But
I haven't either.
But remember,
we have lots of diabetics and a lot of hypoglycemics that use it. I've never heard anybody have any issues.
But remember, is whenever you're hearing about blood sugar and dry mouth, and those are kind of diabetic-related kinds of symptoms, is cut out all the carbs, all the refined carbs, all the wheat, all the sugar, and I know, I remember the first time I heard that, I thought, oh, well, you can't ask people to do that. My gosh, that's crazy. But you know what? vegetables and salads are so delicious nowadays. You can make, there's so many wonderful ingredients you can put in your salads. You can put pomegranate seeds in your salads and sunflower seeds and avocados and mushrooms and dried cranberries. I mean, they're just, these wonderful ingredients that just make the salad so interesting. Artichokes, that if you concentrate on what you can put into your meals, then you don't miss the carbs so much. In fact, that's one of the great things about B complex is most people who have digestive issues have that addiction to carbs. And just remember, the addiction to carbs and to gluten is where you get addicted to that in your brain is the same place you get addicted to cocaine and opiates. And so this is not an easy thing. It's an addiction. And so, but once you get it's like a metabolic imbalance. And once you start, putting the nutrients in, so you start evening out the blood sugar. In fact, one of the things we didn't talk a lot about tonight is the Shaklee 180 shakes, for a morning smoothie, because they have 23 grams of protein and they have 6 grams of fiber. And it's fiber and protein that stabilize blood sugar. And so, that, just having that in the morning, it sets people off on the day with healthy food, that stabilizes blood sugar, so they're not getting into carbs later in the day that messes up their gut. So, and breakfast tends to be such a carby meal anyway. It's good just to get all that toast and bagels and pancakes and waffles and all that stuff just out of the breakfast. That doesn't belong there.
So what do you recommend for someone diagnosed with IBS? And everything we've talked about, the products and things we've covered tonight are not just specific to Crohn's disease. They, especially irritable bowel is a big one. And the Omega Guard would be a big one there. Because of the
It reduces inflammation, Optiflora. I mean, this gentleman I told you, that I told you about with the gastritis, I mean, he had results almost immediately. I mean, the very next day. I mean, these products, people just love them. They really work well. I'm one of the stomach soothing complex 2 tablets and a mug of water and sipping it. It makes just the most wonderful soothing tea. But it doesn't take long. I'll tell you, it's harder. Margaret Mead, she always says it's easier to change your religion, she says, than to change the way you eat. You just understand these are habits. But what is it, 28 days, and you can establish a new habit.
Reprogram yourself.
And I've had people who had acid reflux use Optiflora and alfalfa and stomach soothing, those 3, and get results and get them very quickly. So, all of these will work. And always Optiflora, but then you can experiment with that alfalfa and stomach soothing and the others that are going to give you the best benefit.
And speaking of the Optiflora, someone was wondering when we made reference to ear infections in children, it's the pearl, the Optiflora pearl that we want to get into the kids.
The probiotic.
Thank you, Hannah. People are very appreciative of your sharing your personal story, and so kudos to you for doing that with us tonight.
Well, thank you. Again, anybody that is on this call as a guest, call the person that invited you to the call. Let them help you.
Okay. You're sure living proof of that. Great. Oh, someone asked what the next week's topic is.
Joint health.
Oh, good. Thank you. Okay. Joint health.
Yes, Jim mentioned
and I got Rusty. I think we're going to have Rusty back again, and you will love him, our resident now pharmacist. But didn't you say Rusty, I guess, has had quite a remarkable recovery from joint issues?
Yeah,
we're talking about that. Excellent. Great. See you all next week. Thanks for joining us. Good night, everybody.
Thanks, everybody.